Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. What actually happens in your lungs when you take a puff from an inhaler? And why are there so many different types? Blue, brown, purple, and even those combination devices? In this video, we're breaking down the pharmacology of inhalers, so you'll understand the science behind every puff. When we talk about inhalers, we're usually talking about conditions like asthma or chronic obstructive pulmonary disease. In both, the airways are narrowed either because the smooth muscle is tightened or because there's inflammation and mucus clogging the passages. That's why there isn't just one type of inhaler. Some relax the muscle, while others calm the inflammation. And some do both. Short-acting beta-agonists, such as albuterol, are the classic blue inhalers. They bind to beta-2 adrenergic receptors on airway smooth muscle. These receptors are GS-coupled, so activation ramps up adenylyl cyclase, raises CAMP, and switches on protein kinase A, or pKa. Now, what does pKa actually do? It phosphorylates key proteins that all work together to lower calcium inside the cell and reduce contraction. The end result? Airway opening. Relief comes within minutes, and usually lasts about 4 to 6 hours. Long-acting beta-agonists, such as salmeterol or formoterol, work on the exact same receptor. The difference is that they are designed to stay bound to the receptor much longer, so bronchodilation lasts 12 to 24 hours. They're not for quick relief but for long-term maintenance, keeping airways open overnight or between doses of other therapies. On the flip side, the parasympathetic nervous system narrows airways. Acetylcholine released from vagal nerves binds to M3 muscarinic receptors on airway smooth muscle. These are GQ-coupled receptors, so activation triggers phospholipase C, which cleaves phosphatidylinositol bisphosphate into inositol trisphosphate and diacylglycerol. Inositol trisphosphate then stimulates release of calcium from the sarcoplasmic reticulum. The rise in intracellular calcium drives smooth muscle contraction and airway narrowing. Muscarinic antagonists, like ipratropium or tiotropium, block those receptors. By preventing the calcium rise, they relax the airway and improve airflow. These are especially important in COPD, where parasympathetic drive is a big factor in airway narrowing. Opening the airway isn't enough if the underlying problem is inflammation. That's where inhaled corticosteroids come in. Corticosteroid drugs, such as budesonide or fluticasone, diffuse into airway cells and bind to glucocorticoid receptors in the cytoplasm. Once activated, two steroid receptor complexes dimerize and move into the nucleus. There, they bind to glucocorticoid response elements, or GREs, on DNA and change the transcription of hundreds of genes, dialing down pro-inflammatory cytokines and boosting anti-inflammatory proteins. Over time, this reprogramming of gene expression makes the airways less inflamed, less mucus-clogged, and less likely to constrict in the first place. Because asthma and COPD involve both bronchoconstriction and inflammation, many patients need combination inhalers. For example, pairing an inhaled corticosteroid with a long-acting beta-agonist provides both immediate airway relaxation and control of inflammation. Some inhalers even combine 3 drugs: a long-acting beta-agonist, a long-acting muscarinic agonist, and a corticosteroid, known as triple therapy, for severe disease. So, why are there so many inhalers? It's because each one works on a different part of the problem. Short-acting beta-agonists provide fast rescue by relaxing airway muscles within minutes. Long-acting beta-agonists keep the airways open for the long haul. Muscarinic antagonists block the parasympathetic signals that tighten the airways. Inhaled corticosteroids go deeper, calming inflammation at the genetic level. And combination inhalers bring these actions together, hitting the disease from multiple angles. In other words, every color and every device has its own purpose, whether it's rescue, prevention, or control. Next time you see that familiar blue inhaler, or hear about triple therapy, you'll know what's really happening at the molecular level. It's not just a puff of air. It's a precise pharmacological tool, keeping airways open and inflammation under control. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.